So dear colleagues and friends, it's my pleasure to present my colleagues and myself. I am Dr. Basil Masri, the President of Arab League of Association for Rheumatology. We'll talk about impact of COVID-19 pandemic on rheumatology in the Arab countries, result from an ArLAR initiative. This presentation shared also by my colleague, Dr. Nili Ziadeh from St. Joseph University of Beirut, and Dr. Lina Kebbi from the Specialized Medical Center, Riyadh, Saudi Arabia. So, disclosure, the HARMONIC study is an ArLAR initiative. The manuscript currently submitted and under review for publication. It is already published as a preprint in Research Square. The HARMONIC study is an Arab Adult Arthritis Awareness ArLAR initiative. The manuscript published in the International Journal of Rheumatology in this month, August 2020. So I will talk about an introduction about the Arab League of Associations for Rheumatology. I am consultant rheumatologist in Jordan Hospital in Amman, Jordan. The Arab countries, we have 22 Arab states divided between Asia and the African continents. The total population is approximately 423 millions, living in more than 13,000 kilometers square, and it's considered as the second largest inhabited area in the world. This is the Arab countries maps. In the east, we have Asia and Indian Ocean, and we have at the east of the Arab countries, Iraq and the Gulf countries, and at the extreme west, Atlantic Ocean with Morocco and Mauritania, Africa and Mediterranean Sea in the north and west of the Arab countries. This is the Arab ArLAR countries. So ArLAR was founded in Cairo, Egypt in 29 March 1995 under the name of Pan-Arab Society of Rheumatic Diseases. The name has changed in Amman, Jordan in 2018 to become Arab League Association for Rheumatology, and the board of directors ratified a new bylaws and league. And now we can find everything with the our new website launched in 2019, www.arabrheumatology.org. We can find all the information about ArLAR in Arabic, English, and French. So the main objective of the ArLAR is to represent Arab rheumatologists and promote and pursue excellence of rheumatic musculoskeletal diseases care and to enhance education research among the Arab countries, that advance professional relationship between Arab rheumatologists and worldwide, also to boost research training with the aim of improving health patients with rheumatic and musculoskeletal diseases. This is the countries now represented in the ArLAR. We have 15 countries from Algeria, Egypt, Iraq, Jordan, Kuwait, Lebanon, Libya, Morocco, Oman, Palestine, Qatar, Saudi Arabia, Syria, Tunisia, and United Arab Emirates. But we have 16 organizations because Algeria has 2 organizations. So this is the past ArLAR congresses. We started in 1995 in Egypt, and the last one, so we have then Saudi Arabia, Jordan, Egypt again, many Lebanon, Syria, I think, and the last one, it was in 2018. It was in Muscat, Oman. The coming one should be in March 2020, postponed because of COVID-19 pandemic to next year, to 2021. Hopefully, we can meet face to face in Amman, Jordan, for the third time. We'll organize this meeting in Jordan. So we have also many groups working actively in the ArLAR. We have the Pediatric Rheumatologist Arab Group, the Arab Adult Arthritis Awareness Group, AAA, headed by Dr. Lina Kebbi. She will talk in this video. And the ArLAR Francophone Group, and then the Musculoskeletal Sonography Group also. About the Pediatric Group, they did 4 congresses before as group part of the ArLAR. And the main objective is to increase awareness among pediatric rheumatologists and to help the patients to face and the parents, also the family, with children involved in affected by the rheumatic disease. The Arab Adult Arthritis Awareness Group, it's a good initiative, and I should say that Dr. Lina could be one of the initiators, and Dr. Hussein Halbi from Saudi Arabia in this group before 4 or 5 years, and now they are considered a special interest group, and we have all the Arab countries represented in this group. The main objective is to meet patients' needs about information related to rheumatic diseases in Arabic language or ArLAR website. In ArLAR website, we can find all the activities of the AA group and the ArLAR social media, Facebook, Instagram, website, Twitter, and LinkedIn. The ArLAR Francophone group, it's a group mainly 5 countries, 3 North African countries, Morocco, Algeria, and Tunisia, and 2 countries from the Levant, Arab Levant, Lebanon and Syria, because they are the majority of these countries, they speak very well French. The objective is to communicate the scientific information addressed to the Francophone rheumatologists, those who speak French, and to communicate also scientific information addressed to the general Francophone public, because mainly in the Arab countries, in North Africa countries, Algeria, Tunisia, and Morocco, the population speak very well French, and sometimes addressing in French, it will help us to reach our message to the population. Finally, the ArLAR Musculoskeletal Sonography Group, it's a new group created by the ArLAR, and it's also endorsed by the EULAR. This group has objective to promote musculoskeletal sonography among ArLAR members and beyond. We can have also people coming from outside of the ArLAR participating in this course. So the main idea to organize courses at many levels, at all levels, of course, in musculoskeletal diseases. The new baby of the ArLAR is the ArLAR College, created recently after when we see that we cannot organize face-to-face meeting, and now many meetings go virtual, we decided to launch this ArLAR College. And the main objective of the ArLAR College is to enhance continuous medical education for rheumatologists, improve regional research, and increase cooperation between rheumatologists, university research, and our partners. The faculty is composed by experts in rheumatology from the Arab countries, from the ArLAR, but also from Arab colleagues living abroad in the States, in Europe, and many other countries. We have also criteria for any member to the ArLAR College. Now, during COVID-19 pandemic confinement, we did a lot of work, and we achieved 3 studies. We will highlight in this video the 2 main studies, handling studies and harmonic studies. And now I have the pleasure to present this background of these 2 studies before the presentation of the coming presentation, harmonic studies by Dr. Nelly Ziad from Beirut. So COVID-19 pandemic is a challenging time for rheumatologists and patients. As we know, immunocompromised, the patients are immunocompromised and vulnerable patients. Some symptoms overlap between rheumatic disease and COVID-19. We had some difficulty reaching rheumatologists during this confinement, difficulty for applying telemedicine, and sometimes we have shortage of rheumatology drugs, the example of hydroxychloroquine, and assistance in treating cytokine storms related to COVID-19. So I'm happy to, and it's my pleasure to present my colleague and friend, Dr. Nelly Ziad from San Joseph University of Beirut. Nelly, the floor is yours.
Thank you, Basil. It's a pleasure for me to be part of ArLAR and to present these interesting studies that I had the opportunity to share, to collaborate with the steering committee from different ArLAR countries. Actually, the question is what was the impact of COVID-19 pandemic on rheumatology practice in the Arab countries? So this was the main objective, to check how the rheumatologists are dealing with the pandemic. Okay. So the steering committee designed a 21-item questionnaire. The questionnaire was then validated by the scientific committee of ArLAR, and then it was disseminated to the ArLAR members through email and social media. And the dissemination phase was done online during the month of May 2020. So the ArLAR, as Dr. Basil said, is formed by 15 countries, and around 3,000 rheumatologists work in these ArLAR countries. Most of them are from North Africa. From these 3,000 rheumatologists, we had 858 rheumatologists who participated in the survey. So the participation rate was actually higher than expected, around 27%. Most of the rheumatologists were from, the participation rates was higher in 11 countries, 68%, followed by the Gulf, 44%, then North Africa, 18%. So as in any online survey, you would expect the age categories to be young. So most of our participants were in the 35-44-year-old group, and 60% were female. The mean years of rheumatology practice was 13 years, highest in North Africa. So in every slide you will see the dark green is all the population, the light green here is Gulf, the blue is Levant, and the yellow is North Africa. So as you can see in this slide, our rheumatologists were from institutions implicated in COVID-19 in 40% of cases. So 40% were in frontline institutions, and another 40% were partially involved in COVID-19 management. Most of these were in the Gulf. And personally, the rheumatologists were involved in frontline management of COVID-19 in 29% in the Gulf, 18% in the Levant, and 22% in North Africa. You would not expect this from a rheumatology, which is not usually a frontline specialty in dealing with COVID-19, but I think that this pandemic has changed a little bit all our practice. So what is the impact of COVID-19 on the rheumatology practice? So the main impact was divided in outpatient clinic, day hospital, regular hospital, and income. So we saw a 65% reduction in the outpatient clinic, which was highest in the Gulf and lowest in the Levant, and we will see why later on. 56% of reduction of the day hospital, 69% of the regular hospital. And this was mirrored by a reduction on the income of the practice, 43% in the whole population, and it was lowest in the Gulf. The factors that were associated with the higher impact on the outpatient clinic activity were the region, as we just saw, the use of telemedicine, the impact on income, and the sector. Actually, rheumatologists from the private sector were less impacted by this pandemic, which may explain why the Levant was less impacted, because they have more private sector rheumatology. What about the impact on hydroxychloroquine availability? So we had a shortage in 47% here in the middle. It was higher in North African countries, and we had an additional difficulty of access in 24% of the patients. So due to the initial idea that hydroxychloroquine was effective in the COVID-19 treatment, our patients were suffering from a very important shortage of this drug. So what about the personal infection of COVID-19? And this is to remind you, in May 2020, 15 rheumatologists said they were personally infected, and only 1/3 of them were involved in frontline management of COVID-19. From the 858 rheumatologists, 156 cases of infection among patients with rheumatic diseases were reported, highest also in the Gulf. The main message of this slide is to look at the outcome of the patient and the high mortality rate. So 22% of mortality rate. This does not reflect the real mortality rate of the population. This reflects the patients who come to the attention of the rheumatologist. So as you can see here, as you can deduct here, that the patients who come to us are really the patient in severe cases of COVID-19. So we're not implicated in all patients who were affected by COVID-19. The mental impact of COVID-19 on rheumatologists was high. 60% had a minor impact, and 16% has a major impact, which is highly significant. Are the rheumatologists prepared for frontline implication? Actually, 25% only said they were totally prepared, and 45% said they were partially prepared, and the more prepared one were the rheumatologists from the Gulf. What about telemedicine? Telemedicine is reimbursed in only 12% of cases, which was higher in the Gulf and only 8% in North Africa. This would explain the reluctance of rheumatologists to use telemedicine. Only 54% fully agree to use telemedicine, 24% agree only if it's reimbursed, and 22% do not agree to use telemedicine. So a lot needs to be done in this area. So my take-home message from the HARMONIC study is a high participation rate, 27% of rheumatologists, young responders and females, significant differences between the three regions, and many institutions that were involved in frontline management, 39%. The impact on the outpatient clinic was a reduction of 65% in the activity. It was also a reduction of 56 to 69% in hospitalization, a significant shortage of hydroxychloroquine, a significant impact on mental health, and a significant impact on income. The infection was 1.8%, but I suspect that now it is much higher, and also for patients as well. The COVID-19 pandemic impact was associated with the region, with using telemedicine, with worse impact on income, and the practice sector. So the private sector had less impact of COVID-19. And my final take-home message from the study is that 72% use some sort of telemedicine, phone, email, WhatsApp, etc. But the teleconsultation is reimbursed in only 12%. So 54% fully agree to use telemedicine, and 24% agree to use it only if it's reimbursed. So we need really to work on this to maintain a good access to our patients. And with this, I will stop my presentation and move to Dr. Lina Kibbi, who will talk about the handling study. Thank you.
Thank you, Dr. Nelly, and thank you, Dr. Bassel. I will be presenting the handling study, which is a study which is an initiative by the Arab Adult Arthritis Awareness Group, which is a special interest group and under the umbrella of ArLAR, as Dr. Bassel said. And I will be, this will be the handling study, which is how are the rheumatology patients dealing with the COVID-19 pandemic in the Arab countries. I want to thank the steering committee in which they are from different Arab countries. The objective of this study is to evaluate the current difficulties faced by the rheumatology patient in the Arab countries during the COVID-19 pandemic. The methods of this study, the steering committee formed among the AAA members designed a 15-item questionnaire, and the ArLAR scientific committee was responsible for the scientific review and the validation. The ArLAR representatives disseminate this questionnaire on the ArLAR social media and patient association within 15 days. The AA group also advertised this questionnaire through the AAA network. So this study was grouped according to 3 countries of residence, which is the, as you can see here, our Levant and the Gulf and the North Africa, among 15 countries, which with a population of 333 millions. And we will see the responders from responders for this study. As you can see, among from 8 May 2020 to 22 May 2020, we had the 2,190 a total of who participated in this survey, and they completed this questionnaire. Five responses with missing data, and 22 responses from non-Arab countries. Both were eliminated. So the total who were analyzed, 2,163 patients. And you can see here, the participant according to the country. We have the main countries are the Iraq and KSA and Egypt, around 60% of the participants from these three countries. They account about 173 million inhabitants among among the 333 million inhabitants in the ArLAR country, which is about 52%. So we can see here, according to the region, we divided them according to the Levant, which is 35%, and the Gulf 33%, and the North Africa 32%. And by age distribution, the mean age of the participant was 40 years, in which they were similar in the three regions with a p-value 0.814. Here we divide them according to gender balance, and the females, as you can see, 75%, which is the they were most female with a percentage of 75%, and the male in comparison to male 25%. They were also similar in the three regions with a p-value 0.923. So we will see now the impact of COVID-19 on rheumatic management. And we will see the first one, the impact of COVID-19 on rheumatology visits. The impact on rheumatology visit was associated with the country of residence with a p-value less than 0.01. We can see the Levant less impact on the visits, while in the Gulf more remote visits. And the factors associated with negative impact of COVID-19 pandemic on the patient visit to the rheumatologist. Here we need to say that we are comparing the private sector to as compared to the public and university hospitals, in which the factors was mainly the gender, which is the female, had you can see higher negative impact with a p-value 0.08, and the region the highest impact was in the Gulf and the North Africa, and the lowest was in the Levant with a p-value less than 0.01. The medication non-persistency with a p-value less than 0.01, and the acceptance of teleconsultation with a p-value less than 0.06. What about the impact of COVID-19 on chronic medication? We can see here, according to the graph, 15% stopped because of shortage, and mainly you can see in North Africa. What about the impact on access to hydroxychloroquine? Around half had difficulty of access on shortage, and mostly in North Africa. What about the impact of COVID-19 on precaution during the visit? More masks were in North Africa, and you can see more gloves in Levant and Gulf, and around 10% take no precautions. What about the impact on mental health? We can see 76% had some impact on mental health, more in North Africa, and 50% had a minor impact on mental health. What are the factors associated with negative mental impact of the COVID-19 pandemic? The impact on mental health was associated according to the region, and it was highest in North Africa with a p-value less than 0.01. What about the impact of on the income? 60% had impact on the income, and it was less in Gulf, as you can see in the chart. Then we will be talking about the personal infection with COVID-19. The infection with COVID-19 was statistically correlated with the country of residence with a p-value 0.09. Among the, as you can see here in the diagram, among the 58 cases, 28 was in Levant, and 13 were from Gulf, and 17 from North Africa. Now we will be talking again, like the previous study, about the attitude toward the telemedicine. And here we can see the main question was asking the patients, would you accept to have a teleconsultation? And the result was 98.8 accepted, and 50% they said through internet, and 48.8 through a telephone contact. So this was regarding the teleconference. Source, what about the other question was for these patients was, what is the source of information about COVID-19 that you were following? Mainly 73%, as we all know nowadays, is about social media, which is we need to know that social media now acting very it has a high impact on our patient. 51% television, and the source 8% from newspaper, 6% radio, and 30% from healthcare provider, 20% from friends and family. So I will be saying the take-home messages from the handling study, which is our depending, number one, about the responses of patients to our online survey. We had 2,163 patients within 15 days. They responded to us. Their mean age was 40 years. Most common were the females with 75%, and they said about the home 48%. So what are my second take-home messages? It will be for COVID-19 has a significant impact on impact on rheumatic diseases management. Rheumatology visit 82%, and chronic medication 31%. Access to hydroxychloroquine 47%. Mental health 66%. Also, it affected the income, which is 62%. Personal infection 3%, and personal isolation, which is 47%. The take-home message is number 3. It is did they accept the telemedicine, which is it well accepted? 50% accept it through the internet with the highest in Levant, and 49% accepted through telephone, and it was high in Gulf. By this, I will be ending my lecture, and I will give the floor to Dr. Bassel to give us the take-home messages from the 2 studies. Thank you.
Thank you, Dr. Lina and Dr. Nili. You both beautifully presented the handling and the harmonic studies. So our conclusion for both studies, the recommendation from both studies was beautifully done by Dr. Nili and Dr. Lina. However, we highlighted the drug availability, the importance of the drug. Very important to improve telemedicine in our region, the ArLAR region, as we see that there is hesitation in this. Also following the drug interaction and the COVID-19 with drug use in rheumatology, mental health impact in rheumatologists and on also patient. We need to organize ourselves to have guidelines and to communicate with patient and with rheumatologists. So acknowledgement of this study, the steering committee, the ArLAR members who helped in recruiting, and the reviewer from around the world. We have 3 reviewers from Ireland, from Qatar, and from Egypt. And this is the steering committee. Finally, I hope that we can meet face-to-face also with virtual in the ArLAR Jordan 2021 now, not more 2020. In Amman, Jordan, and to talk about all these things, all the new research and the new communication regarding rheumatology and rheumatology impact by COVID-19. And finally, I would like to thank VUMIDI to allow us to present the ArLAR and ArLAR studies in this video. Thank you very much.